right, so when it comes to looking like a celebrity, there are just a few trade secrets those of us in front of the camera use. So today on our Eye on Beauty segment, we are sharing some insider information, yes we are, with renowned hair loss expert Dr. Alan Bauman. Welcome, doctor. Good to see you.
Good to see you too, Danielle. Thanks for having me.
Thanks for being here. We've been doing a lot of talking off camera. Very interesting subject matter. Now we're bringing it on camera because, you know, you and I know how much work goes into really getting camera ready. Lots of stars and talk show hosts, wink, wink, have to do a lot to make ourselves look like this before we walk out here. I mean, people supplement with hair pieces and extensions and everything else, but I have to tell you, at the end of the day, is there nothing more beautiful than a gorgeous head of hair?
Well, you're absolutely right. They've got a lot of help.
Okay.
Let me tell you, from nutritionals that are pharmacy grade to special prescription medications to the latest state-of-the-art low-level laser devices, diagnostics, testing, to minimally invasive hair transplant surgery to keep them looking good.
I love it. So I want to talk about something that does affect a lot of women, hair loss. It's a very real issue. Something like 30 million women have thinning hair. So what are some of the treatment options and diagnosis for women suffering from hair loss?
Well, it all starts with the right diagnosis. So if you have some thinning hair problems, whether it's a diminishing ponytail volume or receding hairline, you've got to get an examination by a physician. We have diagnostics like genetic testing. We have microscope analysis to look at density and hair caliber. And so then it comes down to measuring the quantity and quality of hair with something like the hair check device. And it's something that we do in our medical offices day in and day out to help patients understand how much hair they have growing in different areas.
Always good.
And also their response to treatments.
When I saw this, I'm thinking, okay, we've got a little mannequin here with a little cap on, but it's a little more involved than that.
Yeah, so we talked a little bit about low-level laser therapy. Your viewers may be familiar with the handheld devices, but this is the laser cap, and let me show you.
Sure.
This is as powerful as our in-office laser hood devices. It has over 200 diodes inside, but the beautiful thing about this is they can use it at home, anywhere, anytime. So you can get your non-chemical, non-invasive, side effect-free treatment for thicker, better, healthier growing hair wherever, whenever you want to.
Wherever, and you put your baseball cap. If you're not comfortable with that, you can put a beautiful scarf.
Scarf can go over it. You can do it in your car, on your bike, while you're answering email.
Here's the thing, though. I understand that we can lose, what is it, 50% of our hair volume before it's even noticeable to the human eye?
Right. Yes, that's right. So it's all about the density, right? If you could lose a little bit of density year by year and still look okay. And that's why an evaluation by a physician is so important. So the measurement tools and techniques that we talked about help us prevent the hair loss process by taking action early.
So we talked about all the diagnostics and you know, different procedures. What about hair transplants? Because that's what a lot of people think about when they think about thinning hair is transplants.
Correct. So the latest and greatest hair transplant procedure is called Neograft Fue. And Neograft is a tool that helps us extract individual hair follicles, literally one at a time if we need to, from the back of the scalp without cutting with a scalpel, without having to put stitches. And we can reimplant those living and growing follicles in the thinning or the balding area. Today's transplants are 100% undetectable. You should never be able to tell the difference between a well-performed artistic hair transplant and a hairline that Mother Nature gave you. Prevention is so important, and enhancing the growth from the hair follicle.
I'm going to make a confession here. I have great brows from here to here, then I have no brows, very little sparse brows from plucking, because you get your brows done every couple of weeks. But I know that you pioneered this great new technique that can help us really get the ultimate Hollywood lashes and brows. Tell me about that.
Correct. Well, eyelash transplant and eyebrow transplants are
really
available. We take the individual hair follicles, again, from the back of the scalp, and we can place them comfortably into the brow area or the eyelash area where they'll live and grow permanently.
Well, how long will they grow? That's a good question, right? Because you're thinking, are you going to have to be cutting them?
Well, Danielle, you do. Yeah, eyelash and eyebrow transplants come with scissors because they do grow long. But that's part of the fun of it. You can let your lashes grow as long as you want.
Beautiful.
You can curl them and style them and so forth. But yes, you will probably have to trim them.
All right, so good note to know. Well, I have to tell you, we've learned a lot here today. So thank you so much for coming by.
Thanks, Danielle.
Thanks for having me. It was a pleasure meeting you. And if you'd like to learn more about what you've seen today, plus lots more ways to get healthier, fuller hair or lashes or brows, simply head to the website, baumanmedical.com.